Hi, I'm Dr. Chris. I want to talk to you today about why your calcium supplement isn't helping your osteoporosis, and in fact, it might be doing you some harm. So, what is osteoporosis? Well, first off, it's the most common metabolic disease of bone, and it is rampant in the United States. I don't know if you knew this, but we have the highest rate of hip fractures due to osteoporosis in the world in the United States of America. Let's talk about what osteoporosis is. So it is a reduction in bone quantity, and it occurs for a lot of different reasons. Now, bones are very unique structures. The interior of bones are made up of spongy bone. It almost looks like Swiss cheese if you were to look at it from the side. The exterior bones is made up of what's called cortical bone. It's much denser and harder. Bones are organized like this so that they're not too heavy, and yet they provide a lot of strength and durability. Now, some degree of osteoporosis is normal as we age because their bones are under the influence of hormones, and our hormones decline naturally. So by the time you're 35 years of age, you'll start to lose about 2% of your spongy bone per year and 1% of your cortical bone per year. But unfortunately, we have much higher rates of decline in the United States. Now, why is that? It's for a couple different reasons. One of the main reasons is that we're much too sedentary in this country. We don't get enough exercise. Bones need high impact activity in order to cause stresses which make the bones regenerate and grow. You know, another common misconception that I think people have is that bones are these dried out, dead things. Well, nothing could be further from the truth. Bones are living structures, and they change all the time based on the forces exerted on them. One of the forces is exercise. You know, bones in their interior have a couple different types of cells. One of the cells are called osteoblasts, and the osteoblast's job is to lay down new bone. Osteoblasts do that when they have stresses exerted on them. The other type of cell that makes up a large proportion of bone are called osteoclasts. These are the cells that chew up the old decayed bone. And in healthy bone, there should be a balance between osteoblastic and osteoclastic activity. As we decline, that osteoblastic activity goes down. So we have all this osteoporosis in our country because we have very little exercise. Another reason is that we have such poor diets. You know, the standard American diet is made up of a lot of simple carbohydrates that are completely devoid of the nutrition that your bones need. People in America love to eat pasta and pies, cakes, rice, cereal, things of that nature that don't provide the nutrition your bones need. In reality, what we need are lots of dark green leafy vegetables, lean meats, eggs, nuts, good fats. All of those things help bone quality. We also don't get enough sunlight in America, and vitamin D is very important for that cortical bone that I talked about. So we don't get enough exercise, we have lousy diets, our hormones are out of balance, we don't get enough vitamin D, and then we eat way too much sugar too. People in America love cookies, pastries, candy bars. A lot of people also get their sugar from alcohol and soda pop. And these things are all very harmful to bones. So let's talk about what happens in conventional medicine when someone is diagnosed with osteoporosis. And I bet you lots of you have gotten this exact advice. If you go to your standard allopathic physician, they'll tell you to take a calcium supplement and go on a drug called Fosamax. Well, those things don't actually fix osteoporosis at all. Let's talk about Fosamax first. It's a drug in the class of drugs called bisphosphates. And the way those drugs work is they block the activity of the osteoclasts, those little cells whose job it is to chew up old decayed bone. That doesn't make any sense. If our bones are living things and there has to be a balance between osteoblastic and osteoclastic activity, and you give a drug that blocks the activity of osteoclasts, you may temporarily on a scan look like you have more bone than someone else, but that bone is of horrible quality. And those people end up having just as many fractures as anybody else. Now, the other advice that people get is to go on a calcium supplement. And I'll tell you why physicians have recommended that. That's actually born out of a propaganda campaign by the dairy industry in the 1950s. The dairy industry did a very good job of convincing everyone that they needed to drink milk and eat cheese to have healthy bones because, well, bones are made of calcium, right? And there's calcium in milk and cheese. There is calcium in milk and cheese, and bones do need calcium, but bones are made up of so many other things too, not just calcium. So by convincing everyone that they should eat milk and cheese and also be on a calcium supplement, they sold a lot of those products. And physicians that are still recommending that are way behind the curve. They're not paying attention to the current studies that are being done. There was just a study done in the last year in Germany that showed that calcium supplementation increases the risk of heart attacks. And I'll tell you, we have a lot of heart disease in this country also, and these problems go hand in hand. That calcium supplementation, instead of actually being absorbed by the bones, it goes into the arteries and goes into the walls and makes your arteries hard and non-pliable, and it causes all sorts of cardiovascular problems. So people that come into my practice with osteoporosis, I get them off those lousy bisphosphate drugs, I take them off the calcium supplementation, I put them on a good, healthy, whole food diet, I get them off the sugar and the junk food, and I check their vitamin D levels. And I'll tell you, their osteoporosis slows and even reverses in some people. So if you're under a current treatment protocol that includes calcium supplementation and a bisphosphate drug, I want you to go back to your doctor with all this information that you just learned today, and I want you to ask some poignant questions, because you're not really addressing the problem in the way that it should be addressed. I want to thank you very much for listening today, and I want to say good luck and good health.